Hello everyone, this is Marika and I welcome you all to this new session of Nursing Management with me. In our previous sessions, we have discussed about what is a disaster, we have discussed what are the different types of disaster, and we have also discussed the psychological effect of disaster on different age group. Now in this session today, we are going to discuss the nurse's role in times of disaster. We have already discussed that the team member within the emergency department must always be ready for mass casualties at times of disaster. When we talk about hospital and different people working in the hospital, of course, nurses plays a vital role in providing care in any of the department. In times of disaster as well, nurses play a very important role in providing emergency care or in managing the mass casualties that occurs because of disaster. The International Council of Nurses encourages the nurses to increase their professional ability before and after the occurrence of the disaster. So it is expected by the International Council of Nurses that the nurses will improve their professional ability at the time of disaster, before the time of disaster, as well as after the occurrence of disaster. Because that is the time when mass casualties will occur, that is the time when emergency medical treatment is required, and therefore nurses or any healthcare professional is required the most. Nurses must prepare themselves in order to provide prevention, preparedness and relief operation at the time of disaster as well as after the occurrence of disaster. Let us discuss the council's role in times of disaster preparedness. The very first function is ensuring that the crucial immediate relief services are provided to the people in times of chaos after the occurrence of disaster. We know that a post-disaster period is all chaotic. There is no proper medical facility. All the basic life requirement of any individual is disturbed after the disaster has occurred. So at such times, at such circumstances, the council is supposed to provide immediate relief services to the people after the disaster has occurred. The second role of the council is to ensure that no human rights are violated after the disaster has occurred. Usually, we see that basic human rights are violated after the disaster has occurred. So it is the role of the council to see that the basic human rights are not violated, which usually occurs after the disaster. The third function of the council is to also see that there is a strong linkage between the relief services as well as development planning, which means the council should make sure that the relief services, the immediate relief services required is also being provided, as well as the further planning of providing a proper treatment to the injured people is also well managed. The fourth main function of the council is to ensure that the financial as well as other type of resources, human resources, are not exploited during the time of disaster. Usually we see that post-disaster period, there will be abuse of the financial resources that has been provided for the relief services of the people or the victims, as well as human resources will also be manipulated, it will be exploited. So it is the function of the council to establish a proper accountable system to look into all of these matters so that there is no exploitation of the finance as well as human resources. All of these things that we are discussing is commonly seen in a post-disaster period. In order to make sure that this does not happen, a proper accountable management system is required, and it is the function of the council to ensure that such system is established during the time of disaster. Another important function of the council, in order to meet the healthcare needs, the council needs to reach out to the government. It also needs to reach out to various relief organizations to see that the relief workers' needs are met as well as the victims' health needs are met. Another very important function of the council to help the country where it functions to plan the disaster prevention and also to reduce the impact of disaster with the existing strategy as well as the equipments available within the country. So the council should help the country to understand how to prepare for a disaster, how to prevent a disaster, and also how to tackle a disaster situation, how to reduce the impact of disaster with existing strategies as well as existing equipment. Another important function of the council is promoting the strategies that supports the social justice as well as equity of the access needed at such times. At times of disaster, we know that healthcare needs of people are different. Different people come with different health needs. Mass casualties will occur, and therefore, and whatever healthcare services are available, the access to the healthcare services must have an equity. That means it must be provided to the people who are in need most. So it is the function of the council to promote such kind of strategies which will help to support social justice as well as equity access to the health and social services. So we as nurses, we have technical skills. We have the skills to use different kind of equipments. We have the skills to perform procedure on patient, as well as we have knowledge on different subjects such as anatomy, physiology, epidemiology. We have the knowledge on sociology, and we also understand the mental health of the people. Therefore, nurses can play a major role in helping a country, in helping the state, a community to prepare for a disaster. Nurses, as they have knowledge regarding different things, they can communicate within the health team members, they can communicate with the community people, they can also communicate with various different governmental, non-governmental agencies to ensure that the required help reaches out to majority of the victims who have undergone a disaster. One very important thing for us as nurses to understand is that not only the victims require the care and support at times of disaster, not only the victims are in need of medical care, but we as nurses must also provide proper care as well as support to the people who are working towards helping the victims of the disaster. So it is the role of the nurse to not just provide medical treatment, emergency treatment to the victims, but also to make sure that they provide proper care and the support that is required by the relief workers. Why is it necessary for the nurses to also provide care and support to the relief workers? Because relief workers are those people who are working to help the victims of the disaster. So people who work as relief worker also have experienced a human tragedy, and therefore they may be stressed because they have experienced a human tragedy. They may be tired by providing continuous care, the help that is required by the victims, and also they're providing care to the people, to the victims with very little resources that is available immediately after the disaster. Therefore, it is the role of the nurse to provide proper care as well as support not just to the victims but also to the relief workers. I hope you've understood the role of the council during the time of disaster and how important role does a nurse play during the time of disaster prevention, mitigation, preparedness and relief. Let us see the prevention, mitigation and preparedness activities that a nurse is expected to perform. There are few things which the nurse must be aware of. The very first thing is that a nurse working in a particular country, working in a particular community or a state must be aware about raising public awareness among the people about those natural disasters which is most likely to occur in the particular region. Which means the nurses must know what are the different ways for a nurse to raise awareness on natural disaster in order to help people understand better about the natural disaster and also to understand how they can prevent natural disaster. So as a nurse, we must be aware in a community where we work, in the society, in the country where we work, what are the natural disasters that are most likely to occur in the particular region. Not just knowing what are the natural disasters, we must also know that what are the different ways of raising awareness about it in the public. The third thing that as a nurse we must be aware about is the disease and the social behavior that may be associated with the disaster that can most likely occur in the particular region. So every disaster may cause different kind of harm to the community, to the physical environment and to the people. As nurses, we must not only be aware about what kind of natural disaster or how can we make people understand about the natural disaster, but we should also be aware about associated problems, associated illnesses, and social behavior that may be seen in the post-disaster period. The next thing the nurse must be aware is the associated mental, physical, and socio-economical nursing needs. As nurses, we must be aware about the different kind of nursing needs that may arise after the disaster in the community that we work or in the state or country that we work. Another important role that a nurse can play is to make sure that she brings in together the government, non-governmental institution and other various relief institutions that work for disaster management to plan in advance about the disaster prevention. As nurses, to prepare for the disaster is also one important function, and as nurses, we must bring together the government, the non-government, as well as various relief organizations and prepare for the disaster together. When various institution, government and health sector come together, they can prepare in advance for the disaster by understanding about the potential hazards or by planning what can be done, what actions can be done in order to respond to such kind of situation. Another important role of a nurse is, of course, to actively participate in times of planning as well as implementing the disaster management plan. Another important role that a nurse can play is to develop as well as implement relevant policies, legislation that is required in times of disaster. Another important function of the nurse is to celebrate the World Disaster Reduction Day. When is the Disaster Reduction Day celebrated? It is celebrated on 13th of October every year, and therefore it is the function of the nurse to organize the program and to conduct and celebrate World Disaster Reduction Day. So these are the things that a nurse can do in order to prevent the disaster. Now let us see what are the activities that can be carried out by the nurse during the relief response. The very first activity that a nurse can do is to mobilize the available resources such as food, shelter, clothing, water and also emergency medical facilities. So in times of disaster, we've already understood that all of the basic life requirements may be lacking in the post-disaster period. Therefore, to mobilize the resources to the place where it is required is one of the main functions of the nurse. This may include food, water, shelter, clothing as well as the emergency medical assistance that is required by the victims. The nurse can also provide special attention to the people of the vulnerable groups such as children, women, handicapped, etc. The another important thing that a nurse can do is to work within the existing capacities, skills, resources and organizational structure. So at times of disaster, when the casualty increases in huge number, we cannot demand for new facilities or new resources. Of course, we can ask for it, but being a nurse, we cannot wait for all those resources to be available at that particular time. With the limited resources, whatever resource, skills or capacity we have, we need to immediately function in times of disaster. In the long term, the nurse can also help the victim in other things such as resettlement programs, psychological, economical, as well as legislation needs. Another important role that can be played by nurse is to develop partnership with government, with non-governmental organization, with voluntary organization, as well as media in order to make sure that the necessary medical assistance as well as the basic requirement reaches out to the victim. Another important role played by a nurse is also providing care to those who are involved in providing direct care to the victim. This one we've also discussed earlier, where we have seen that it is the role of a nurse to provide care to those people who are providing care to the victim, which means for those people who work as volunteers, those people who work as relief workers also need care and support, and therefore they are directly involved in providing care to the victims. And the role of the nurse is not just providing care to the victim, but also to those people who are involved in providing care to the victim. So these are the activities that can be carried out by a nurse during the time of disaster preparedness, mitigation, as well as relief. I hope you've understood today's session, where we have discussed the role of a nurse in times of disaster and the activities that can be carried out by a nurse during the time of disaster. So that is it for today's class. I'll see you all in the next session, where we will discuss about disaster manual. Thank you and have a great day ahead.